Hello friends, I am Dr. Udit Kapoor. Welcome back on my YouTube channel. Today I am going to talk about muscle cramps. What it is, why few people develop muscle cramps, and few preventive measures I'll be explaining you at the end. So keep watching the video till end. Let's begin with the topic. So basically, what is muscle cramp? Muscle cramp is a sudden involuntary contraction of muscles which is medically known as spasm. In layman term or commonly in India, people call it as nas pe nas chadna. Basically, this happens at night or after workout sessions. So the area which is involved are legs, your thighs, your abdomen and your chest area. These are commonly affected by this muscle cramp. So what can cause this muscle cramp? Muscle cramp is basically caused by dehydration. If the patient is having electrolyte imbalance or dehydration in the body, that can lead to muscle cramps. By electrolyte imbalance, I mean if the patient has sodium, potassium, calcium or a magnesium deficiency, that can lead to muscle cramps. So second thing is if the patient is having over usage of the muscles, like after in the workout sessions, if he is exerting himself, that can lead to muscle cramps. Next thing is if the patient has vitamin deficiency, vitamin B or vitamin D deficiency can lead to muscle cramps. Next thing is if the patient is anemic, if the blood levels, hemoglobin levels in the blood are less, so that can also lead to muscle cramps. This is basically because there will be no supply of blood only in the muscles, so that can lead to muscle cramps. Next thing is if the patient is pregnant female can also develop muscle cramps. If the patient is on dialysis, hemodialysis, if the patient is having, so these patients already have kidney failure, that can also lead to muscle cramps. Next thing which comes is if the patient has any neuromuscular disorder, like if the patient has Parkinsonism, like any neuropathies, that can also lead to muscle cramps. The next thing is if the patient is taking any medications like diuretics, statins. So there are many more. If the patient is having these medications, that can lead to muscle cramps. There are certain risk factors involving it. Risk factors like if the patient is elderly male or a female, that can also have a risk of developing muscle cramps. If the patient is overweight, that can also lead to muscle cramps. If the patient is exerting too much, like in the workout sessions, during the exercises, so that can also lead to muscle cramps. If the patient is having hypothyroidism, if the patient is alcoholic, if the patient has kidney failure, these are few things, these are like risk factors. I've already mentioned vitamin D deficiency, vitamin B deficiency. These can also lead to muscle cramps. So what you need to do for this? You don't need to go to hospital. This is for sure. If the patient is having these symptoms or these signs for first time, he or she should not worry and no need to see a doctor for the first time. If it's a usual thing, then what you need to do? First of all, hydrate yourself. This is the key rule, this is the thumb rule. Hydrate yourself by any electrolytes. There are so many electrolytes available in the market. Like you can have anything. Even the Red Bulls, they have taurine. There are so many literature saying that taurine helps in preventing your muscle cramps. So you can go for that. Even these are like sugar free nowadays. So many fruits like banana, pineapple, kiwi. These have like electrolytes, sodium, potassium, magnesium, calcium. These can also help in removing this issue. Next thing is whenever you're doing your exercises, always stretch yourself. Without stretching, you don't have to work out. That's the key rule. Next thing is whenever you are going for a workout, don't eat and just go. Take a gap. There should be a gap. If you're having your meals like lunch or dinner, take meal. Then only you need to work out. Half an hour to 1 hour, there should be a gap. If you're having night cramps, like if you're having these cramps at the night time, so you need to stretch yourself before sleeping. If you are doing so, that will also be a preventive measure for this thing. So these are few things which you need to follow. I hope you guys will follow it and do let me know how it was, and keep watching, keep liking, keep subscribing. Thanks for watching.